Thank you for having me here. I grew up in the south side of Chicago in a neighborhood called Beverly. Lived here most of my life. Dwindling few of us in Beverly. And I came back to Chicago at the beginning of the century, I should say, to begin to look at community organizing here and getting to work here. What I heard mostly when I moved back here was stories about insurance. That became real clear that that was the issue in front of most people, even ahead of education, ahead of child issues, ahead of most issues. Over and over you heard it. And then the 2008 election, the Progressive Future, that's all you heard when you knocked on doors. Insurance, insurance, insurance. From the richest to the poorest, everybody was talking the same game. So that was kind of the reason I got into this work myself. Just very quickly on HCAN, we're 1,000 organizations representing 30 million people across the United States. We're 32 organizations here in Illinois. We're also 5,000 small businesses, and here in Illinois, we're 450 of those small businesses. We're building a very strong and diverse organization here in Illinois. Just to go back to where this all started for us, last July is when we kicked this off in Illinois, to kick this whole campaign off to win healthcare reform. As a national organization, it was a very diverse group of people who came together, from La Raza to AFSCME, to Move On, to groups like that came to the table. Some small businesses came to the table to discuss what is the best solution for healthcare and what can we begin to pass in 2009. One of our major goals was to get a shot at this within the first 100 days, because we strongly believe that most of Obama's political capital will be lost at the end of this year. And if healthcare doesn't come across, that we'll lose seats in 2010. So that was part of the thinking behind the timeline we chose. So HCAN, diverse organizations, 42 states, building capacity in congressional districts to push our congressional members locally, and then coming back in DC, and we have a team in DC that's also lobbying there, and that is at the table. We're part of the Healthcare Summit. Richard Kirsch, our director, was part of that. One of our leaders gave testimony from the Ways and Means Committee in the House 2 weeks ago, Dave Boris, and has talked about the problem small business has as far as health insurance. Sorry. The issue as I see it now, and again, I'm Irish, so somebody tell me when we're very close to 10 minutes, or I'll talk for an hour and a half. Obviously, you guys know the issue. 700 people lose their insurance every day in Illinois. 42% of the uninsured Illinoisans right now are adults who cannot qualify for public insurance. So that's a huge chunk of folks that are just wandering folks that either gets this huge crisis care, or simply just goes to the clinic to get blood work, and they do what they can. They find ways to survive within the system. We also know the top 4 insurance companies in Illinois, $11 billion in profits, right? Average salary for a CEO, any of you looking for jobs, is $8.75 million, with Aetna making $32 million. In fact, I was a vice president, wasn't a CEO. We got the $32 million. So certainly, as we heard, there is a huge amount of space between greed and service as it relates to this issue. And I think that's the major thing we're all trying to bridge is how do we turn this from a greed capitalist enterprise to a service, just like a quarter of our economy already is a service sector, a service. I'll leave it at that. So for me, when I'm looking at this issue, and I'm sure most of you know the principles already, it's the same principles, well, some of the same principles you're fighting for. The idea that we want coverage you can afford. So we're shifting this from a for-profit system where they want to collect the healthiest and the youngest people that don't use insurance. That's where their profit is, and then shift the sickest 5%, which is 50% of our healthcare costs, shift that to government, right? So government, you take care of the problems, we'll take care of the healthy kids, and we'll create something for the people that we still have to insure, people that apply to us. But basically, we're going to make our living off 18 to 30-year-olds. Because that's where all the cash is, right? So especially now, this is such a huge generation. It's bigger than the baby boom out there right now. So there's a lot of cash to be made off of youth. The idea of comprehensive benefits we can count on, the idea that every American, everybody in America should be able to access the same quality care. Just like when I was a kid, just Blue Cross Blue Shield, right, the nonprofit hospitals. Before HMOs, everybody got the same care in our neighborhood, the richest and the poorest. So how do we access that care? How do we access, so we look at the equity issue. And a lot of the neighborhoods I used to work in, you'd have, the best they'd have is a clinic in a church room, right? And that's where everybody go for their care. So we have these little TB outbreaks. We have these clusters of diabetes. We have all these problems coming about, and because people just couldn't access quality care. We know that in neighborhoods where there's not good service, we know in the African American community especially, when they've done surveys, what they found out is that less than half receive the appropriate care for diabetes too. They get maybe one of 3 things they're supposed to get. And certainly I'm not an expert in healthcare. But there's an equity issue, is I guess the point I'm making there. And then the idea that we think real choice is what put pressure on the industry. So I know this is where the big elephant is, or whatever you call it, the elephant in the room, which I guess that's good because that's a Republican thing, is the idea that we think the downward pressure, the only way to make true competition is to bring a public health insurance option, right? That public health insurance option is accessible to everybody. It's equally transparent, and it's shown exactly the same way as a private plan. So when you go to this insurance exchange, there's the public plan, there's Bob's Insurance, there's Acme, whatever, and they're laid out, and you know exactly comparatively what you're getting. You can keep the insurance you have now, or you can opt into the public health insurance plan. So what that does is leave choice up to the folks and puts pressure on the fact that if there's an efficient plan that's cheaper, people are going to begin to move over there, right? So beyond the 91 million people that already can apply for these kinds of plans, what's going to happen is you might see folks that when they see that choice, they're going to say, I want to go to a government plan. There's a bunch of Americans that would never go to a government plan, right? There's a bunch of folks that just don't trust the government, or they don't think it's the government's role, or whatever. So there's these 2 groups of folks out there, folks that don't trust private industry and folks that don't trust government. I fall in between, I don't trust either. But the idea that exists right now. So for us, when we're strategically thinking about this, is we have to give people a choice. I'm going to do this from an ideology perspective and a strategic perspective. From an ideological perspective is it's not the choice of it shouldn't be the politician, it shouldn't be the insurance industry, and it shouldn't be the activist that tells people what kind of insurance they have. It should be that we create choice, and if there's an equal playing field, there is an equal playing field, which is a problem I know you guys have, is can it ever be equal, right?